Title: The Catastrophic Implications of Scientific Fraud, the Beta Blocker Scandal. Introduction. The integrity of scientific research is foundational to public health and medical practice. When this integrity is compromised, the ramifications can be devastating. One of the most alarming cases of scientific fraud in recent history involved a cardiologist who manipulated data to falsely assert that beta blockers improved surgical outcomes. This case not only led to significant changes in medical guidelines across Europe but also resulted in a tragic increase in mortality among patients who underwent surgery while taking these medications. This report chronicles the events surrounding this scandal, highlighting the critical need for ethical standards in medical research. The initial fraud. The saga began when a cardiologist whose identity remains undisclosed conducted research aimed at examining the effects of beta blockers on patients undergoing heart surgery. Through falsification of data, he claimed that these medications significantly improved surgical outcomes. His findings, which were published and presented at various medical forums, were met with enthusiasm in the medical community, prompting a swift reevaluation of preoperative care protocols. The cardiologist's fraudulent research quickly gained traction, leading to the revision of medical guidelines across Europe. Prominent medical associations began to recommend the use of beta blockers as a standard preoperative treatment for patients undergoing heart surgery, believing they would enhance patient safety and reduce complications. Change in medical guidelines. As a direct consequence of the fraudulent data, European medical guidelines underwent a significant transformation. The use of beta blockers became widespread in surgical settings, with healthcare providers prescribing them to millions of patients prior to surgery. The enthusiasm for the medication was fueled by the perception that it was a safeguard against potential complications during and after surgery. However, the scientific community was unaware that the foundation upon which these new guidelines were built was deeply flawed. The cardiologist's misconduct went largely unchallenged for some time, illustrating the vulnerability of the medical system to fraudulent claims, especially when they align with existing beliefs about patient care. Uncovering the truth. The turning point in this narrative came when independent researchers began to scrutinize the outcomes associated with beta blocker usage in surgical patients. As new studies emerged, they contradicted the earlier findings and raised questions about the safety of beta blockers. Investigators discovered that rather than decreasing risks, beta blockers were correlated with a staggering 27% increase in the risk of death for patients undergoing surgery. The realization of these findings prompted a wave of alarm within the medical community. Further investigations into the initial research revealed the extent of the fraud. The cardiologist had manipulated data points and selectively reported outcomes to create a false narrative that beta blockers were beneficial. The impact on patients' safety. As the truth about the fraudulent research came to light, the implications became dire. Estimates suggest that the misguided recommendations could have led to the deaths of up to 800,000 patients in Europe alone who were prescribed beta blockers under the false assumption that they would be protected from surgical complications. The shockwaves from this revelation rippled through the medical community, leading to a reevaluation of the guidelines and the immediate withdrawal of beta blockers from preoperative protocols for heart surgery. The human cost of this fraud is incalculable. Families lost loved ones and countless patients faced unnecessary suffering due to the adverse effects of medications that were supposed to help them. The scandal not only eroded trust in medical guidelines but also raised critical questions about the standards of evidence that underpin medical practices. Responses from the medical community. In the aftermath of the scandal, the medical community took several proactive steps to address the crisis. Organizations began to implement more rigorous peer review processes and enhance transparency in research funding and methodologies. The incident served as a wake-up call to the importance of maintaining ethical standards in scientific inquiry. One notable initiative that emerged was the Medical Evidence Project. spearheaded by researcher James Heathers. This project aims to identify and eliminate bad medical evidence before it can harm patients. Through collaboration, the initiative seeks to develop tools and best practices to ensure that medical guidelines are based on robust and reliable data. Conclusion: the beta blocker scandal serves as a stark reminder of the potential consequences of scientific misconduct. The case underscores the critical importance of integrity in medical research and the need for vigilance in the evaluation of scientific claims. As the medical community continues to grapple with the fallout from this incident, it is imperative that lessons are learned to prevent similar occurrences in the future. Rigorous scrutiny of research transparency and a commitment to ethical standards are essential to safeguarding patient welfare and restoring trust in medical practices. The implications of this fraud extend beyond the immediate loss of life. They highlight the ongoing challenges faced by the medical community in ensuring the safety and efficacy of treatments. As we move forward, a renewed focus on accountability in research practices will be vital in protecting patients and advancing the field of medicine. The case of scientific fraud involving a cardiologist who faked data to promote the use of beta blockers before surgery is a striking illustration of how one individual's unethical actions can lead to widespread and potentially fatal consequences. The ramifications of this fraud are not just limited to the medical community but extend to the very foundation of trust that patients place in healthcare systems. The key points that emerge from this case are critical to understanding the broader implications for medical research and patient safety. Counterintuitive insights. 1. Trust in medical guidelines. The fact that medical guidelines can change based on fraudulent data highlights a counterintuitive reality, that the very systems designed to protect patient safety can be manipulated. This challenges the assumption that established medical guidelines are always based on solid, reliable research. In this case, the reliance on potentially flawed studies can lead to life-threatening recommendations showcasing a systemic vulnerability. 2. Impact of single studies. Another counterintuitive element is the overwhelming influence that a single fraudulent study can have on medical practice. Medical guidelines are often seen as the culmination of extensive research and consensus within the medical community. However, this case shows that the integrity of just one study can lead to widespread changes in practice affecting countless patients. It raises questions about the robustness of peer review processes and the checks and balances in place to prevent such fraud from influencing clinical practice. 3. Evident disconnect between research and patient outcomes. The revelation that beta blockers, once thought to improve outcomes, were linked to a 27% increase in mortality presents a stark contradiction to the initial claims made by the fraudulent research. This disconnect between research findings and actual patient outcomes emphasizes the critical need for ongoing monitoring and evaluation of treatments rather than a blind acceptance of research conclusions. 4. Scale of consequences. The potential death toll of up to 800,000 people is staggering and perhaps counterintuitive in its scale. It is easy to underestimate the real-world impact of academic misconduct. The numbers involved here are a grim reminder of the stakes involved in medical research. This case serves as a poignant reminder that the consequences of scientific fraud are not limited to academic circles but can extend into the lives of real patients, sometimes with catastrophic results. 5. Response to fraud. The emergence of initiatives like the Medical Evidence Project aimed at identifying bad medical evidence before it causes harm indicates a proactive approach within the medical community. This is counterintuitive in the sense that one might expect a more reactive stance to fraud focusing on punishment rather than prevention. The shift towards finding and addressing bad evidence before it leads to clinical practice changes shows a growing awareness of the need for vigilance in the face of potential misconduct. 6. Patient perception of medical authority. This case may alter how patients perceive medical authorities and guidelines. The betrayal of trust that arises from such fraud can lead to skepticism about medical recommendations, which is counterproductive to the goals of healthcare professionals who strive to maintain patient trust. patients may begin to question not only specific treatments but also the validity of the entire medical establishment, which can hinder effective treatment and public health initiatives. Conclusion: the case of the fraudulent cardiologist and the subsequent fallout underscores the complexities and vulnerabilities inherent in medical research and practice. It serves as a cautionary tale about the potential for scientific misconduct to have far-reaching and devastating consequences. The insights drawn from this incident highlight the need for a more nuanced understanding of how research influences clinical practice and the importance of maintaining rigorous standards in scientific inquiry. As the medical community works to rectify these issues, the balance between trust in medical guidelines and the necessity of skepticism and scrutiny must be carefully navigated to protect patient welfare. The case of scientific fraud involving the falsification of data by a cardiologist regarding the efficacy of beta blockers before surgery is a critical event that highlights numerous oversights and lessons within the medical and scientific communities. While many discussions may focus on the obvious consequences, the immediate impact on patient safety and the loss of lives, there are subtler yet equally significant aspects that tend to be overlooked. 1. The role of peer review in scientific research. One of the most alarming oversights in this case is the apparent failure of the peer review process that typically serves as a safeguard against such fraudulent practices. The peer review system is designed to ensure that research is scrutinized by experts in the field before publication. However, it seems that the checks and balances intended to uphold scientific integrity were either bypassed or insufficiently robust in this instance. Significance: this raises critical questions about the effectiveness of peer review in catching fraudulent data and whether reliance on this process is warranted without additional layers of verification. It underscores the need for reform in how research is evaluated and suggests that additional methods such as independent replication studies could be vital for verifying findings before they lead to changes in clinical practice. 2. Impact of confirmation bias in clinical guidelines. The rapid adoption of beta blockers into European medical guidelines based on the fraudulent research illustrates a significant problem of confirmation bias within the medical community. When studies appear to confirm existing beliefs or practices, there may be less scrutiny applied to the data. In this case, the belief in the benefits of beta blockers before surgery may have led to a rush to adopt the findings without thorough investigation. Significance: this phenomenon highlights how pre-existing biases can distort scientific judgment, resulting in potentially dangerous clinical practices. It emphasizes the importance of maintaining a critical perspective and fostering a culture of skepticism and inquiry, even regarding widely accepted treatments. 3. The consequences of medical miscommunication. Another critical aspect that may be overlooked is the role of medical communication in propagating misinformation. The fraudulent findings not only influenced guidelines but also affected the information disseminated to healthcare providers and the public. The communication of these findings likely led to widespread acceptance of beta blockers as a standard preoperative treatment without proper understanding of the underlying risks. Significance: understanding how misinformation can propagate in medical communities is crucial. It suggests that medical professionals must be trained to critically evaluate emerging research and that there should be mechanisms for updating clinical practices based on new, credible evidence. There is a need for continuous education on the importance of evidence-based medicine and the potential dangers of adopting new treatments without adequate scrutiny. 4. The ethical responsibilities of researchers. The ethical responsibilities of researchers and the repercussions of failing to adhere to these standards are significant themes that may be glossed over in discussions about the fraud itself. The cardiologist's actions not only betrayed the trust of the medical community but also had devastating consequences for countless patients. Significance: this case serves as a somber reminder of the ethical obligations that come with conducting research, particularly in fields that directly impact patient health. It highlights the importance of ethical training and accountability in research practices to prevent future occurrences of such misconduct. 5. The need for transparency and whistleblower protections. The eventual exposure of the fraud suggests a lack of transparency within the research community. It raises the question of whether there were early warning signs that could have led to the detection of the fraud sooner. This situation underscores the importance of fostering an environment where individuals can safely report unethical behavior without fear of retaliation. Significance: implementing robust protections for whistleblowers and promoting a culture of openness could serve as deterrents against scientific misconduct. Encouraging transparency in research practices can help to build trust within the scientific community and among the general public. 6. Long-term implications for medical research funding. The fallout from this scandal may also have long-term implications for funding in medical research. Instances of fraud can lead to increased scrutiny and skepticism toward clinical trials and research funding, potentially stifling innovation and progress in medical science. Significance: this case may lead to more stringent funding applications and oversight, which could hinder research efforts. It is essential to balance the need for vigilance against fraud with the need to support genuine scientific inquiry to avoid creating an environment that is overly punitive or risk-averse. 7. Psychological impact on medical professionals. The ramifications of this fraud extend beyond patient outcomes. They also affect the mental health and professional integrity of healthcare providers who trusted the guidelines based on fraudulent data. The realization that they may have inadvertently harmed patients can lead to significant psychological distress among medical professionals. Significance: recognizing the emotional toll on healthcare workers is crucial for developing support systems that address the psychological impact of such betrayals of trust. Ensuring that healthcare professionals have access to mental health resources can help them cope with the fallout from unethical practices in their field. Conclusion: the case of the cardiologist who faked data regarding beta blockers is a stark reminder of the vulnerabilities within the scientific and medical communities. While the immediate consequences, loss of life and misguided clinical practices, are evident, the subtler implications regarding peer review processes, biases in research acceptance, communication of medical information, ethical standards, transparency, funding, and the psychological impact on professionals are equally significant. Addressing these overlooked aspects is essential for fostering a more robust and trustworthy medical community, ensuring that scientific integrity prevails and that patient safety remains the top priority. The lessons learned from this tragic event should catalyze efforts to strengthen safeguards against future fraud and to promote a culture of accountability, transparency, and continuous improvement in medical research. The case of scientific fraud involving the falsification of data regarding beta blockers and their effects on surgical outcomes serves as a crucial example for discussion in the realms of ethics in research medical guidelines and patient safety. Here are 4 valuable points for in-depth analysis and discussion. 1. The mechanisms and consequences of scientific fraud. The case begins with a cardiologist who deliberately manipulated research data to suggest that beta blockers improved surgical outcomes. This action raises significant ethical questions about integrity in medical research. The implications of scientific fraud are profound, as they can lead to misguided clinical practices, ultimately endangering patient safety. A thorough examination of the motivations behind such fraud, whether they stem from personal ambition, pressure to publish, or a flawed peer review process, can offer insights into how to prevent similar incidents in the future. Understanding the psychological and systemic factors that contribute to scientific misconduct is essential for fostering a more trustworthy research environment. 2. Impact on medical guidelines and practice. The fraudulent data resulted in a major shift in medical guidelines across Europe, promoting the use of beta blockers in surgical contexts based on the false premise of improved outcomes. This illustrates how a single piece of fraudulent research can ripple through the medical community, leading to widespread changes in clinical practice. Analyzing the processes by which medical guidelines are developed and revised can help identify vulnerabilities in the system that allow for such sweeping changes based on flawed evidence. Discussions could also focus on the role of regulatory bodies, peer-reviewed journals, and the importance of re-evaluating guidelines as new evidence emerges. 3. Increased mortality risk and public health implications. The discovery that beta blockers were linked to a 27% increase in the risk of death for surgical patients highlights a catastrophic outcome stemming from the initial fraud. This statistic serves as a stark reminder of the potential consequences of misleading research, with estimates suggesting that up to 800,000 patients may have died as a result. An analysis of the public health implications of this incident can lead to discussions about the responsibilities of researchers and the medical community to prioritize patient safety. The case emphasizes the need for rigorous post-market surveillance of medical interventions and the importance of having systems in place to quickly address and correct harmful practices. 4. Efforts to combat bad medical evidence. In the wake of this incident, initiatives like the Medical Evidence Project led by James Heathers aim to identify and rectify bad medical evidence before it leads to further harm. This proactive approach represents a shift in the medical community towards greater accountability and transparency. Discussing the importance of such initiatives can highlight the need for ongoing education and critical appraisal of research, as well as the integration of evidence-based medicine into clinical practice. Furthermore, exploring the role of technology, such as data analysis tools and artificial intelligence, in detecting fraudulent research could provide insights into future safeguards against similar occurrences. Conclusion. The case of scientific fraud involving beta blockers is a multifaceted issue that encompasses ethical considerations, the impact on medical guidelines, public health repercussions, and the ongoing efforts to improve the integrity of medical research. By analyzing these points in depth, stakeholders in the healthcare system can foster a culture of accountability, enhance patient safety, and ultimately improve the quality of medical evidence that informs clinical decisions. Here are 3 famous historical cases of scientific fraud that bear similarities to the described case involving the falsification of data related to beta blockers. 1. Andrew Wakefield and the MMR vaccine fraud. In 1998, Andrew Wakefield published a study in The Lancet that falsely linked the measles, mumps, and rubella MMR vaccine to autism. His research suggested that the vaccine caused gastrointestinal issues leading to developmental disorders, sparking a worldwide controversy and a significant decline in vaccination rates. Subsequent investigations revealed that Wakefield had manipulated data, failed to disclose financial conflicts of interest, and had ethical violations related to his research. The fallout led to a public health crisis with resurgences of diseases previously under control, and it is estimated that thousands of children may have suffered as a result of the misinformation propagated by his fraudulent study. 2. Diederik Stapel and social psychology data fabrication. Diederik Stapel, a prominent Dutch social psychologist, was found to have fabricated data in numerous research studies over a period of years, leading to significant repercussions in the field of psychology. Stapel's fraudulent research, which included studies on topics such as consumer behavior and social identity, influenced academic discourse and policy. A series of investigations revealed that he had manipulated data to produce desirable outcomes, resulting in the retraction of over 50 published papers. The scandal prompted a broader examination of research practices in psychology, emphasizing the need for more rigorous peer review and replication efforts to ensure the integrity of scientific research. 3. Paolo Macchiarini and the synthetic trachea implants. Paolo Macchiarini, a former surgeon and researcher, gained notoriety for his work on synthetic trachea implants, which he claimed were revolutionary for patients with severe airway issues. However, investigations revealed that he had misrepresented the success of his surgeries and the safety of the implants. Several patients experienced severe complications, and some died as a result of the procedures. His actions raised ethical concerns over the conduct of clinical trials and the integrity of scientific research in medicine. The case led to a reevaluation of oversight in surgical practices and highlighted the dangers of unverified medical innovations. Each of these cases underscores the profound impact that scientific fraud can have on public health and safety, similar to the hypothetical scenario involving beta blockers. The case of scientific fraud involving the manipulation of data by a cardiologist regarding beta blockers has far-reaching implications for the future of medical research, public health, and the integrity of scientific practice. As we look ahead, several predictions can be made about how this incident will shape various aspects of healthcare and research integrity. 1. Increased scrutiny of medical research. In the aftermath of this scandal, we can anticipate a marked increase in the scrutiny of medical research. Regulatory bodies and peer-reviewed journals are likely to implement stricter guidelines for research validation. Expect to see more robust peer review processes and the demand for raw data from studies to be made available for independent analysis. This trend will aim to restore trust in scientific literature and reduce the incidence of fraudulent research. 2. Evolving guidelines and practices. The fallout from the fraudulent beta blocker research will likely lead to a re-evaluation of clinical guidelines and practices in cardiology and beyond. Medical associations may adopt a more cautious approach to updating guidelines, emphasizing the need for comprehensive data before endorsing treatments. This could slow down the pace at which new therapies are adopted, prioritizing patient safety over rapid guideline changes. 3. Emergence of advanced analytical techniques. To combat scientific fraud, the adoption of advanced analytical techniques such as machine learning and artificial intelligence (AI) for data verification will become more common. These technologies can help identify anomalies in research data and detect patterns indicative of falsification. As a result, researchers may increasingly rely on these tools to ensure data integrity. 4. Stronger ethical standards in research. In response to this scandal, there will likely be a push for stronger ethical standards in training and research conduct. Institutions may implement comprehensive training programs focused on research integrity, ethics, and the consequences of misconduct. This shift aims to foster a culture of transparency and accountability within the scientific community. 5. Patient advocacy and informed consent. As awareness of the potential consequences of scientific fraud grows, patient advocacy groups will likely demand greater transparency regarding the treatments they receive. Informed consent processes may evolve to include discussions about the credibility of the underlying research supporting treatment recommendations. This shift will empower patients to make more informed decisions about their care. 6. Interdisciplinary collaboration for evidence-based medicine. The scandal may also spur increased collaboration among interdisciplinary teams focused on evidence-based medicine. Healthcare professionals from various fields, including statisticians, data scientists, and ethicists, may work together to assess and validate medical research. This collaborative approach can enhance the rigor and credibility of studies before they influence clinical practice. 7. Ongoing monitoring of medical outcomes. Future healthcare systems may place a greater emphasis on ongoing monitoring of medical outcomes associated with new treatments. This could involve the establishment of registries or databases to track patient outcomes over time, allowing for real-time assessment of the effectiveness and safety of prescribed treatments. Such systems would contribute to a more dynamic approach to healthcare, ensuring that treatment protocols are continually updated based on the latest evidence. 8. Public awareness and media scrutiny. The case has the potential to raise public awareness about the importance of scientific integrity in healthcare. Media scrutiny of medical research may increase, leading to a more informed public that actively questions and engages with health information. This shift could place pressure on researchers and institutions to maintain high standards of integrity and transparency. 9. Regulatory reform and accountability. In response to the high stakes of scientific fraud, regulatory bodies may undergo reforms aimed at enhancing accountability. This could include stricter penalties for researchers found guilty of misconduct and the establishment of independent oversight committees to investigate allegations of fraud. These measures will aim to deter unethical behavior in research settings. 10. Global collaboration on research integrity. Finally, the global nature of scientific research means that this case could inspire international collaborations focused on research integrity. Countries may come together to establish shared standards and best practices for conducting and reporting research. This collaborative effort can help create a more uniform approach to combating scientific fraud worldwide. Conclusion. The case of scientific fraud involving beta blockers serves as a crucial reminder of the potential consequences of misconduct in medical research. The future outlook suggests a landscape where research integrity is prioritized, healthcare practices are more cautiously adopted, and there is an increased emphasis on transparency and accountability. As the medical community learns from this incident, efforts to prevent similar occurrences will shape a safer and more reliable healthcare system for all.